Broadreach Nature Advanced Dental Care. Hello, my name is Dr. Barbara Fougere. I'm the in-house veterinarian for Broadreach Nature. I've been a veterinarian for more than 35 years and a veterinary herbalist for more than 20 years. Today we're going to talk about how this product works, research that supports the ingredients that we've chosen, and the benefits of the product. We're going to talk about periodontal disease first of all. It's really common in cats and dogs. 82% of dogs between 6 and 8 years of age and 96% of dogs over 12 have periodontal disease. Now, if you've got a small breed dog with a lot of hair around the mouth, they can get periodontal disease as young as 1 year of age. Now, in cats, 50% of cats over 4 years of age and 93% of cats over 8 years of age have got periodontal disease. Now, what does this mean? Gingivitis is just inflammation of the gums, and a lot of young animals have inflammation or redness around the base of the tooth. But periodontal disease is often something that you can't see. It actually occurs underneath the gum lines. Now, the teeth are held in by connective tissue or ligaments, and with periodontal disease, those ligaments begin to detach. Bacteria cause the periodontal disease. They produce products that break down these dental ligaments, and that makes the teeth loose, and eventually these teeth can fall out or have to be extracted under anaesthetic. So it's actually a really important disease. It's one of the most common diseases of cats and dogs. You should also know that the unseen condition, what you can't see necessarily, is an important established risk for kidney disease. In this picture here, you can see redness around the gums. That's gingivitis, but you can also see a buildup of calculus, which is the brown yellow material on the tooth. And you can also see evidence of infection, which is really that grey goo between the gum and the tooth. And that's really just bacteria. There's also a link between periodontal disease and changes to brain function in dogs. That's doggy dementia. And that's also the case with people too. There is a strong association between having dental disease or poor dental hygiene and getting conditions like dementia or Alzheimer's disease. Now, one of the ways that we treat periodontal disease is with normal veterinary care and dental hygiene. So, if your dog has bad breath, if they have any difficulty with gnawing bones or doggy chews, things like that, if your cat has bad breath, then you need to get them examined by a veterinarian. One of the first things the veterinarian will do is recommend a dental clean, because it's not until we actually anaesthetize a cat or a dog that we can actually probe and check underneath the gum line as to what's happening. The teeth may look perfectly white, but they can still have periodontal disease. So once a patient is anaesthetized, and we have very safe anesthetics to do this with, then we can check every single tooth and the health of the gums and what's happening underneath the gums. And then the teeth are cleaned. So we don't just clean the white part that you can see, but we're also cleaning below the gum line as well. And every now and again you'll find a tooth that looks okay, but in fact has very deep pockets, and there is evidence of infection, and those teeth usually need to be extracted. Sometimes teeth can be saved with special techniques, but more often than not, those teeth will need to come out if they are very diseased. But what can we do to help reduce bacteria, inflammation in the mouth, and slow down the progression of the disease, especially once you've had them cleaned professionally? Well, there is a lot we can do. And one of the things we can do is use supplements that contain phytochemicals. So let's look at those now. Advanced dental care contains a number of ingredients, and one of them is Calendula officinalis. Yep, that's calendula, the little flower on the right. Calendula has some really interesting properties and has been well researched for dental disease. It's antibacterial or antimicrobial. It helps heal wounds and is anti-inflammatory as well, particularly against bacteria that cause problems in the mouth. It can also block or inhibit the breakdown of collagen, which is part of the connective tissue that keeps teeth in their place. And it can also reduce the breakdown of bone around the tooth as well. It aids in reducing plaque that builds up on the teeth and also gingivitis. We've also included a microalgae, actually a few different microalgae, but we'll talk about this one first. This is Chlorella. Now, Chlorella is a microscopic algae, and it increases saliva production, and saliva is really important in dental hygiene. It helps keep bacteria down, but it also helps carry immune properties in the mouth. So Chlorella improves the immune function in the lining of the mouth and around the teeth, and it has potent antibacterial and antioxidant activity, and both of these are important in keeping bacteria at bay and reducing inflammation. Saccharomyces is another important ingredient. A component of Saccharomyces is called beta-glucan, and this has been shown to reduce bone loss in periodontal disease. So once you start to lose bone around teeth, it makes those teeth loose and wobbly, and we want to try and minimize that as much as possible. It also assists in the control of inflammation around the teeth. So together with the other ingredients, it's really important in controlling disease around the teeth. We've also included turmeric. Turmeric's been shown to be as effective as some of the medications that are used to manage dental disease, such as chlorhexidine. Turmeric reduces plaque and gingivitis, and therefore can be used both in the prevention and treatment of gingivitis. In a little study where they had some beagles with periodontitis, the dogs were treated with a modified form of curcumin after they'd had their teeth cleaned. And after 3 months, the treatment significantly reduced the clinical measures of dental disease. And another little study that was done with dogs showed that turmeric root powder mixed with ghee, which is a clarified butter, accelerated the wound healing of gums and reduced inflammation in the mouth. They were also beagles. So we've got some nice evidence that turmeric is very helpful both in prevention and treatment of the milder conditions like gingivitis, as well as the more serious more deep-seated dental disease. We've also used the seaweed Ascophyllum nodosum. Now this is a common seaweed that's used in a lot of dental hygiene products for animals. It directly inhibits bacteria in the mouth and oxidative damage caused by those bacteria. It also reduces plaque and calculus and gingivitis in people, and it's been shown to improve the same oral health indexes, plaque, calculus and gingivitis, in dogs and cats. So there's a good evidence base that it's safe and helpful for those conditions. It assists the immune system, and we believe that it interferes with bacterial growth and accumulation in and around the teeth. It's absorbed in the intestine when you give it orally, and some of the constituents are excreted into the mouth via the saliva. That's how we think it works. Here is another microalgae called Haematococcus, and this is a natural source of astaxanthin, which is a red pigment or a carotenoid. This has been shown to be antioxidant in dogs and also anti-inflammatory, and it improves the secretion of saliva and therefore the immune system in aging animals, and that's in the mouth. And this microalgae can also reduce bone loss around the teeth, so it has a protective effect, a bit like the chlorella that we talked about and Ascophyllum nodosum. So what are the benefits of advanced dental care? First of all, we've combined some really important plants and algae into this formula, including calendula and turmeric. They provide some well-researched benefits against the development and progression of dental disease. We've also included microalgae and Saccharomyces, which also provide important dental health benefits. It's easy to mix with food, and the formula is quite potent and relies on synergy, so we can use lower doses of each ingredient because they enhance each other. This provides a natural and nutritional approach to supporting dental health care. It's a safe, well-tolerated and easy-to-use product, and as a trusted brand, you can be confident that we don't use any irradiated ingredients. We use non-GMO ingredients, and we manufacture to good manufacturing practice. This provides assurance of quality and consistency with our products. The ingredients we've used are designed to specifically target dental health and to support animals with a predisposition to dental disease, gingivitis, and periodontal disease. Now, it's ideal to begin this product when animals are young, before they get dental disease. If you think your companion has bad breath or has any signs of inflammation around the gums, please take them to see your veterinarian, who can advise you on the best way to get that sorted out. One of the horrible things about periodontal disease is it's below the gums. You don't often see what's going on, and it can be a source of pain as well as infection. We don't want you to use these products and miss something as important as periodontal disease, because we would hate to think that your animal has dental pain. But if you can start them off early with this product and help prevent dental disease, and especially after they've had a dental clean with your veterinarian, that's the ideal time to get them onto this product to help reduce the number of times that you'll need to have them cleaned, also to minimize progression of deeper dental disease. And what we're trying to do here is limit the bacteria in the mouth and prevent plaque buildup, gingivitis, and the more problematic periodontal disease, which is quite deep-seated and you can't always see it. So it's still important to get your dental checks every time you take your pet to see the veterinarian. If you'd like more information, please contact us at Broadreach Nature.